views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello, everyone, and welcome to Open, the one and only show that opens the Bronx and the rest of the world right to you. I'm your host, Daren Jaime. Today, we'll update you on what's happening in and around our borough and New York City. Coming up on today's show, we go front and center learning about a not-for-profit health plan that's specializing in providing comprehensive health coverage and coordinated care to New Yorkers with complex conditions. Then afterwards, we'll discuss the partnership between New York Blood Center and Feeding New York State that's helping communities who are still suffering the effects of the COVID-19 pandemic. Then a little later on in the show, we'll talk with the Chief Executive Officer at Homeward NYC. We'll talk about how they're providing housing services to homeless young mothers, LGBTQ young people, as well as older adults. And then finally, we'll discuss the homeless LGBTQ plus youth crisis that's in New York City and how one organization is helping to provide meeting their needs. So we've got a very interesting show coming up for you. We want you to stay with us because Open begins right now. I'm Daren Jaime, and welcome to Open. Today is Wednesday, March the 9th, and you're watching Open, a live and interactive program that brings the Bronx and New York straight to you. We also want to welcome our viewers who are watching on Manhattan Neighborhood Network, as Open is being broadcast live simultaneously on the MNN channel. Now, we also want you to stay connected to us on all of our social media platforms. You can do that by going to BronxNet TV, and always check our website at bronxnet.org for not just this program, but all the programs that are appearing on our station. A lot has been going on through the course of this past week. Can't take you through everything, but we can bring you through a couple of things with our Bronx updates. We start off with news across the state. New York State Governor Kathy Hochul announced that no longer will face coverings be required in schools. This follows after the mask mandates in most indoor settings, including shops, grocery stores, offices, apartment building common areas, as well as entertainment settings, were lifted in mid-February, but individual companies can still set their own rules and require face coverings. Vaccine requirements in the 5 boroughs will also be reduced, but the order mandating public employees to get vaccinated or lose their job will still remain in effect. New Yorkers will still need to wear a face covering while on public transportation. This includes taxis as well as congregate care settings, such as nursing homes, correctional facilities, and homeless shelters. This regardless of a person's vaccination status. Now, face coverings must also still be worn in healthcare settings. In other news, lawmakers and community members announced their plans to reimagine the abandoned Westchester Avenue, announcing plans to reimagine abandoned Westchester Avenue train station. Our BronxNet reporter Sanji Lopez was there, and she has our story.
It's been abandoned and covered in moss and branches for decades, and soon lawmakers and community leaders hope this former Westchester Avenue Amtrak train station will be open to the public.
Behind us, we have a river, right? The Bronx River. And many people may remember that river at one point was polluted, vacant, and abandoned as well, too. And we worked to clean that up. And this is our next project. We just wanted to highlight the report that was recently done that said that this project is feasible, that this project is attainable, and it's possible to be open for the community.
The cost of restoring the Westchester Avenue station is estimated to be somewhere between $10 and $15 million. And so the restoration should and must be a team effort. It's going to require funding from both sources, public and private, funding from the federal and state and city government.
It's going to be a beautiful, beautiful building with access to green spaces, to the waterfront, to enjoy the infrastructure and the historical nature of this building. So, I mean, this is a wonderful day for Bronxites.
BronxNet took an exclusive tour inside the historical Cass Gilbert train station built in 1908 and shut down in the 1960s. Renderings by Slow Architecture reveal that the crumbling yet stable infrastructure will soon serve as a hub for Bronx River right-of-way here in the community.
This project is about infrastructure. It's taking a piece of architecture, a beautiful piece of architecture that was about one kind of infrastructure, which was the train, and it's transferring it to this new 21st century green infrastructure, which is the Greenway, the Blueway, and that is really key to our design.
At the forefront of this effort are grassroots community organizations, including the Youth Ministries for Peace and Justice, YMPJ, and Loving the Bronx. They say it's important to ensure that local community is involved in every step of the restoration and planning process.
When I look at this project, there's so much development that's coming to this area, and what really lacks is a community space. So when we look at this restoration and renovation of this amazing architectural gem, it's for the community.
We get all these ideas for years from the youth of what they imagine could be in that community space, and now they get to see it come true. They get to be a part of the experience. They get to be a part of the history.
Never underestimate the sheer power of grassroots activism, right? The cleanup of the Bronx River, the creation of Concrete Plant Park, the recreation of the Sheridan Expressway, the rebuilding of the Bronx in the aftermath of arson and abandonment. The future of the Bronx does not belong to the gentrifiers. It belongs to the grassroots, and I'm proud to be supportive.
Growing up here in the Bronx, I used to marvel at this building down the BX4 line, so this is a dream come true. While community members and elected officials don't have a timeline yet for the project, funding is underway. Reporting for BronxNet, Sanji Lopez.
And thank you, Sanji. That's all the time we have for our Bronx updates. We want you to stay with us because we do have a full open show coming up right after this. Welcome back. March 10th is National Women and Girls HIV and AIDS Awareness Day, which is a day to focus on the work being done to reduce HIV and AIDS diagnoses amongst women as well as young girls. Now, Immediacare has developed a highly effective specialized model of care that provides individualized attention and support to people with HIV and AIDS as well as other complex health issues. Sharing now more details, we're pleased to have the Assistant Director of Member Events at Immediacare, Sandrine Blake. And Sandrine, good to have you.
Great to be here. Thank you for having me.
Well, we want to talk a little bit about Girls HIV AIDS Awareness Day and a very important time for you. But talk to us a little bit about the significance and the importance of this day.
The significance of this day is just really important, like you said, Daren, in highlighting what's being done to reduce the risk of HIV diagnosis among women and girls within our communities, especially across the nation. We definitely want to highlight the struggles. We want to show how these women have been coping, how far we've come with research, with information and data, and just showing some of the disparities, especially within our own community here in New York City. Some recent data from 2020 is showing that 95% of new diagnoses in New York City were among women of color. And it just shows that there are disparities within our city and things that we still need to highlight and work on to get to where we need to do in lowering the epidemic rate right now.
When we talk about the epidemic rate, we do know that the rates are continuing to grow. We know that there are challenges that are out there. So for somebody that may not be so familiar, what are the challenges that particularly young women are dealing with when it comes to HIV and AIDS?
Some of the challenges young women may be seeing is access to care, discrimination, socioeconomic challenges, overall stigma, poverty, and even just, locating where where you can go, where the doctor's office is and a local clinic, having that comfortability to talk with your provider. There may be other issues in the home or at school that may stop someone, especially someone of a younger age, in going and just even finding out your status. It starts with finding out your status, just getting tested. There is so much fear in just getting tested, and that's where it begins. And even if you get a positive diagnosis, it is not a death sentence. We are in 2022, and we have ways that you can live a healthy, viable life, even if you're affected.
So when we talk about this, we know that there's that fear stigmatism, and you highlighted that earlier, that even to this day in 2022, there's still a lot of fear. But for women out there who may be at risk, women out there who may be dealing with this particular challenge, give me some advice that you would like to share with them to help them along the way to get past the fear stigma and possibly move in the area of receiving resources.
Oh, definitely. Again, the first thing, get tested, right? Go to a local clinic, a hospital, doctor's office, and get your status, right? From there, even if it's a negative status, but you might be, at fear because of potentially the lifestyle you're living, you might be at a at-risk nature. There is pre-exposure prophylaxis, and it's known as PrEP. And it's critical in fighting against the HIV virus. It's a 1-a-day pill that individuals who are negative can take that has a 90% effective rate in preventing HIV transmission. And that is just the start. Especially for those who may feel they are at a higher risk in getting the virus. There are other options out there in just maintaining your medical health. And it starts with knowing what you can do. It starts with identifying community-based organization, a proper healthcare provider like Immediacare that can start to help you navigate this path to a better, healthy lifestyle.
So as you mentioned, you're from Immediacare, and Sandrine, I want you to share with us a little bit more in this area because you provide services and you actually are helping women with boots on the ground who are dealing with this issue. So a little bit about Immediacare and the work that you guys are doing, particularly in this area.
Well, definitely. Thank you for asking. Immediacare is a community-based health plan. We are the largest Medicaid special needs plan based out in New York City, and we look at healthcare in a more comprehensive way. But I want to say it's not just about medication, right, Daren? It's about the whole care of an individual. And we often even find that we're taking a holistic approach in ensuring that our members are fully cared for, because we want to ensure, do you have transportation to get to your medical appointments? There might be an issue with food in the home, like food insecurity, where we want to connect members with other organizations to help them with some of these issues. Immediacare's motto is health, advocacy, and care. It's about making sure our members are fully healthy, right? And giving them that seamless access approach to their health path. And then it's also about advocating, going and lobbying for Medicaid and healthcare rights, right? Not just around HIV, but also around socioeconomic conditions that may be facing many of our members. It's also about housing. It's also about, our advocacy for our trans women that are on our plan and our members who are of the transgender experience, and ensuring that they have access to get the care and to surgeries that are needed for their own mental health, their physical health, and their overall spiritual and emotional health as well.
Yeah, I want to go over some numbers because I think numbers will put things in better context, particularly for those who are here in the borough of the Bronx and across New York City. In 2020, 95 60% of new HIV diagnoses among women in New York City were women of color. In 2020, 60% of newly diagnosed cases of HIV among women in New York City were Black women. And also 24% of all New Yorkers living with HIV are from the borough of the Bronx, a total of over 30,000 women, and the Bronx having the highest percentage of people living with HIV out of any borough in New York City. Given these statistics, are we seeing more and more women, particularly from the Bronx and in our area, coming through the doors and asking for services, or is there still this lack of coming forward?
I want to say it's a little bit of both. We really have to be in depth about the community that we're reaching. Immediacare just doesn't wait for our members to come through our doors. We are in community. Like you said, boots on the ground. We are at our local hospitals. We are at community-based organizations. We're at health fairs in within the areas, just ensuring that we have that touch point, because it's great that people can see us as a health plan, but it's even better when they know us, when they can identify me and say, hey, that's Sandrine, she can help me, or I have a friend that she can help. Because sometimes that intimate conversation opens up our women in just feeling a little bit more comfortable and having those a little deeper conversation, because it is a harder topic for some to talk, but it is a topic with any woman or man throughout the city. And it doesn't matter if you are of the trans experience or not. We just want you to be educated on your own health and also how HIV is affecting our community.
Yeah, the work you do is so important. And I mean, obviously, with the numbers and the statistics that are out there, and we see the numbers continuing to rise, particularly in the borough of the Bronx, as well as across New York City. Give me just your perspective on the importance of what you're doing and how you feel it's making an impact.
Oh, it's definitely making an impact. It's critical to be on a plan like Immediacare, because we're not just a health plan, we are your health partner. We're really working with you as an individual to say, this is where you're at right now, but this is where you can be with better health care. And again, like I said before, it's not just about taking your one-a-day pill or getting a shot. It's also about everything else that plays in your whole life factor. So it's really important that we're not just seen, we're heard, we're known. People have access to come to our storefront area. We're in communities providing our wellness events to members, because one of the key things that I do at Immediacare is provide our wellness events. We know that people may not have the opportunity to do yoga, to do meditation, to learn how to prep a healthy meal for themselves. We bring this right into the community free of charge. Like you said, Daren, boots on the ground. We are not just a talking health plan, we're a doing health plan. And that is key, that our community is seeing that we're not just talking the talk, we're really doing it.
Yeah. Well, Sandrine, I want to thank you for the work that you are doing and providing much needed resources, and particularly as we see those numbers that are kind of startling, but then alarming. But glad to know that there are people who are out there trying to make a difference, and Sandrine Blake and Immediacare doing a great work. Thank you so much for being with us.
Thank you, Daren, for having me.
All right. And in case you missed it, March the 10th is National Women and Girls HIV and AIDS Awareness Day. Now, if you want more information, we encourage you to visit the website at immediacareny.org. We do have more show. We encourage you to stay with us. Open will continue right after this. And welcome back to the show. Since the start of the COVID-19 pandemic, there has been a blood shortage as well as an increase in the need for food bank services. Well, New York Blood Center is partnering with Feeding New York State for their Save One, Feed One campaign and will be donating on behalf of every presenting blood donor who registers to make a donation in their honor. Joining us now and sharing more details, we are pleased to have the manager at special events and projects at New York Blood Center, Christine M. Foran. And Christine, good to have you. And as we talk about this here, this is a marriage of two not-for-profit organizations really coming together to make a difference in the lives of New Yorkers.
It's a great description. It really is. New York Blood Center, we've been around since 1964, working to make sure that all blood needs are met for our community. It takes about 2,000 pints every day to supply the New York hospitals. So that has obviously been our main focus. And since the pandemic, we've been greatly affected by it. Donations would always come from, places of business, schools, places of worship, community blood drives. Once the pandemic came, that all shut down. If you recall, people weren't going into work anymore. Schools all went remote. So that source of blood donation dried up as well. And that was really a huge impact on us. As we've been rebounding, we've been bringing back those drives, and school blood drives are back. Corporate blood drives are really slowly returning. Really our donor centers and our community-based donors and getting out the word to how important blood donation is has been key to us. But also greatly impacted by this by the pandemic has been Feeding New York State and the food banks across America. Feeding New York State is actually part of the larger Feeding America organization. And, in kind of looking at the situation, the problem is bigger than just blood. The problem is food as well. So we thought, this could be a great partnership and a chance to help others as well as patients in hospitals, but as well as help people who are hungry.
Yeah. So you've got the Save One, Feed One campaign, and that's designed to helping people in the area of blood donation, getting those donors out there, and at the same time also being able to help food insecurity in New York City. Can you share with us a little bit about how that program is going to launch out?
It's a great program. It is called Save One, Feed One, but interestingly enough, one blood donation can save up to 3 lives, and $1 can help feed 4 people. So, potentially you have the chance to really help 7 lives here. So the way it works is people need to come to a New York Blood Center blood drive. They're very easy to find. If you just go to nybc.org and hit donate, you'll find a ton of options to donate blood. We have donor centers, we have mobiles. So they need to come into one of a drive, and then they need to go on our website and register and saying, yeah, I want to help the food bank, so that we know that they really would like to help and make sure. And for every donor that does this, we will donate $1 towards the food bank. This program will run from March 1 to March 31. So all donations in between March 1 and March 31 are eligible. And what's great is, I know I'm personally going to donate on March 13th. I've already registered my donation. I want to make sure that that my dollar is going to go to the food bank. So I've already gone in advance to register. And donors can do that. If they know they have an upcoming appointment, they can go to nybc.org and register their donation and then still donate anytime during the month of March.
So if a person wants to donate blood, maybe they've never done it before, give our viewers an opportunity to know about the process. They go, they donate blood. How long is the process for a person that wants to give a donation?
The actual process takes about an hour is what we tell everybody. And, I know everybody out there has taken an hour commuting, taken an hour going to the gym, taken an hour looking at their phone. I'm sure they can find an hour to donate blood. They'll come in, they will go through a registration process, an online screening process where we ask a number of questions, including, are you feeling well and healthy today? We'll ask some various questions about medications. Most medications are completely eligible, but if somebody might have just been on antibiotics, something like that. So we'll go through a deferral screening questionnaire. From there, they go on to what we call medical history. They'll get their blood pressure taken, their pulse, their iron, and they'll review those questionnaires, making sure that somebody is eligible to give blood. From there, they go on to the actual donation process. That's when they actually lie on the bed and donate their blood. And that's about 10 minutes. And from there, everybody goes to the favorite part, which is canteen, and that is juice and cookies. So you're going to get yourself some Lorna Doones, some Oreos, some chips, and we're just going to make sure that you're feeling well after your donation, and then you'll go on about your day. But within an hour, to think that you can actually go in there and save 3 lives and potentially feed 4 people, what a great way to spend an hour.
Yeah, we've talked a little bit about earlier about the pandemic and how you've actually been affected, and blood donation shortages really continuing, and getting donors a hard thing to do given the fact that we've been on lockdown. Are you sensing a good rebound in this area, given the fact that we're moving closer and closer out of this pandemic? We're out of the worst stages. Are you sensing a rebound?
We're sure trying to, and we are seeing, we did get a little bit of a bump in donations recently, but unfortunately, like, for example, like the little ice storm that happened last weekend, anything like that can impact donations. As people are saying, stay off the roads. Well, they're staying off the roads, and they're certainly not going to donor centers when the weather hits or something bad. So unfortunately, it's such a volatile type of situation, in that blood donations can be good and we're ramping up, and then something can happen that can impact us. And blood only lasts 42 days, so similar to food being perishable, blood is perishable. So people can donate blood every 56 days up to 6 times a year, but blood is perishable, and after 42 days that donation you made wouldn't be good anymore. But here's the thing, we're not even seeing blood last 42 days on the shelf. Blood is going in and out of our system in 5 days or less. Right now, we really are trying to rebound. We like to be within that 5 to 7 day range, and we're a little under that right now, and we're really trying to come back from that. So a 5 to 7 day is an ample blood supply that can help us be better.
Yeah. So you're partnering, as we said, there is a partnership that's going to take place, and people will also be able to help in the area of food transportation through food insecurity that's affecting so many people here in New York. Are you confident that this particular program will be able to be a one that actually really makes a long-standing difference?
We are really optimistic. I want to say I'm confident because that's just my nature, but we're also super optimistic. We've even said, hey, we're hoping that this is going to become an annual March event. And interestingly enough, we chose March because people tend to be very generous with the food banks around the holidays. Everybody's always thinking about donating others and helping others. In March is when the food banks are starting to be impacted. And, New Yorkers are hungry. I have a statistic here. That over 3 million New Yorkers are food insecure. 3 million, that's a huge number. And 1 in 6 New Yorkers rely on the charity food bank. So if we could help them, and then also make sure that blood is there for patients in need, because, cancer patients are the #1 users of blood, accident victims, burn victims, they all need blood. So if we can make sure that food is there for people who are hungry and blood is there for patients who need it, it would be a great system.
So how does one go about making an appointment? I know that you said it only takes about an hour, but if somebody wants to make an appointment and do this, how do they go about doing that?
They have 2 options. They can call 1-800-933-2566, which actually transfers out to 1-800-933-BLOOD. Or they can go to our website, nybc.org, which is obviously short for New York Blood Center. So nybc.org. There's a donate button right there, and they can go in there, put in a zip code, and find the closest blood drive right to them.
Yeah. You mentioned cancer patients a little earlier as the #1 recipient for blood donations. Who are some of the other recipients that are actually receiving these donations?
Cancer patients are the #1, which everybody thinks accident victims, and accident victims do use a lot of blood. But burn victims can use blood. Newborn babies can use blood. Sickle cell patients actually use a lot of blood, and we partnered with a number of them to help get their word out. Thalassemia, they require 2 transfusions every other week. So many diseases, and then sometimes, childbirth. I've heard of mothers in childbirth needing blood. Various surgeries. So it's amazing. Blood is therapeutic, and blood is life, and that's why it's so important that blood is always on the shelves. A lot of people say, "Oh, well, I'll donate blood if a family member or friend needs it." But what people don't realize, it's the blood on the shelf today that's helping tomorrow's accident victim. Every blood unit that we get is tested and processed and make sure that it's eligible to be transfused. And the reason why we say that, 1 donation can save 3 lives is we take the blood and we split it into components. We split it into red cells, we split into platelets, and into plasma.
Yeah. Before we go, I know we have to end the segment, but I do want to get this question in there. Is there anybody that's not eligible to donate blood, or is there some things that people should know that if I might have a good heart, but I may not be the right person to donate blood under certain circumstances? Would you please share?
Sure. I mean, quickly, I can tell you, you need in New York State, you need to be at least 16 with parental consent, or 17 to 76. You need to weigh at least 110 pounds. You need to be feeling well and healthy. There are various medications that might restrict you from donating blood. Approximately 60% of the population is eligible to give blood on any given day. But we have all of this information on our website as well. So if somebody's curious and they want to donate blood, they can certainly find it all there, or that 1-800 number I gave earlier, 1-800-933-BLOOD, they will be able to help them and go through. But once they get in, like I said, we will go through a screening questionnaire with everybody there too.
Yeah. Christine, thank you so much for joining us and being here with us. Great work making sure that people are helping in the area of donating blood. It's much needed across New York City. And then also tackling another huge issue, food insecurity across these 5 boroughs. Thank you so much for being with us.
Thank you so much for having me. I really appreciate this.
All righty. Well, we want our viewers to know, if you want more information, listen, you can go to the website at nybc.org/save one, feed one. And then also you can follow them on Facebook as well as Instagram at New York Blood Center. We do have more show coming up. We encourage you, don't go anywhere. Open's going to continue coming up right after this.
When taking public transportation, don't touch your phone. Carry hand sanitizer and use it immediately upon leaving the bus or train. Avoid touching your face. If someone is coughing or sneezing, move away. Wash your hands with soap and water as soon as possible. Limit contact with poles. If possible, avoid rush hour. Don't eat or drink on public transportation. Keep your bag off the floor or other surfaces. Avoid directly touching turnstiles. Stay up to date with the latest from your local health department and CDC.
And welcome back. Homeward NYC provides transitional housing for homeless young mothers and their children, non-time limited affordable housing for LGBTQ young adults, and long-term affordable housing for low-income and homeless seniors. Now, they believe by obtaining housing first, homeless New Yorkers can find the stability that's necessary to address trauma, as well as build the skills that they need as they transition into the next phase of their life. Here now, sharing more details, we've got the Chief Executive Officer at Homeward NYC, Jeannette K. Ruffins. And Jeannette, good to have you. And as we talk about this work here, really providing a much needed service, because when we talk about homeless New Yorkers, that number continues to rise, but then you've got a really target group that you're really working with as well.
Yeah, so actually we serve 3 very different populations, right? So we serve homeless young mothers. They come in between the ages of 18 and 24, and they have children usually under the age of 6. And for many of them, you know, and this is shelter, transitional housing, right? And so our expectation is that they come in, we help them stabilize, address their immediate needs, right? Make sure they have clothing, food, are connected to healthcare, that their children are in care, have seen a doctor lately, take care of those things. And then kind of what do they need to transition to permanent housing, right? And so for many of our young mothers, I mean, they left with kind of acrimonious separations between their nuclear family. So it is an opportunity for them while they're on their own to maybe mend some of that. it's a chance for them to talk about what they want for their future, although in transitional housing, it usually just starts them on that path, right? It is kind of, are you thinking about school? Where do you see yourself in 3 years? And then what skills do you need when we move you into permanent housing to hold on to it? Because many of them have not had their own apartment. And so I think things like budgeting, most of them are on, if not very low income, fixed incomes, right? And actually, I have to say, I have found people on fixed income can budget better than many of us who have a lot more money, right? Because they have less money to do it with. But now they have a child, and they have to consider the needs of that child in there. So we help them with that. Many of them have experienced trauma. Many of them have not been in healthy relationships before that. So there is some conversation about what that is, what you want for yourself. How do you keep yourself safe? How do you negotiate a healthy relationship with your partner? Because many of them have them, even when they're not living with them in the transitional housing. And then what do you need? What are your top priorities as you're here for 9 to 12 months? What are your top priorities, and what can we do to help you move forward and be stable? Because for many young women, this is a cycle of homelessness. Many of our young families have been homeless already and have been homeless as children. That building is an intergenerational building. It actually shares space with seniors. So for our seniors, and a significant portion of our seniors are also coming out of homelessness. And so we know that homeless seniors have health issues almost, it's like if you're in your 60s, you have health issues of somebody who's almost 20 years older than you, right? Mainly because you've been homeless and you haven't had a chance to address your health care. So that's an opportunity. That's one of our primary concerns, is making sure you have your health care is stable, that you're connected to a primary care physician, that you're no longer running in and out of urgent care and emergency rooms. And then trying to create a community for our seniors, right? Trying to make sure that they are going to a senior center or reconnecting with people that maybe they lost connections with while they were in shelter and had to move around, so that they have a support system. Talk a lot about nutrition. We talk a lot about, even mental health. Many people have come into shelter with a level of depression and anxiety. So we have staff that works with them to help that. And then they too are kind of how to manage on a fixed income to be as healthy and as happy. And for us, we really do want people to age in place. So it's really trying to figure out what are the support systems that would allow you to do that. Now, we've been around since 1989, and we started with the intergenerational site. And the other thing about having the intergenerational site, before I move to the other population, is that, the interaction between the seniors and the young mothers are helpful for both of them. It keeps seniors young to be around young people. And then I also think for some of our young mothers who have, who do not have the best relationship with their families, it's nice to have an older adult kind of just giving you advice, even though as all young adults, sometimes they don't want to listen to it, right? Yeah. But it is good to see other people have experience. And then our other population is we serve LGBTQ young adults. So we.
I'm sorry, I didn't want to cut you off, but I wanted to talk to you about that, because when you talk about serving LGBTQ adults, this is the latest initiative that I know that you have, because I know that you're managing 3 sites, and you've got the Bronx, and then you've also got Harlem as well. And your LGBTQ community that you're serving right now is the most recent. Am I correct?
Right. So that's happened. So we had the seniors and the young adults and the young mothers for a really long time. In about 2011, we opened our first site, our permanent housing site for LGBTQ young adults. Partly because if you think about 7% of the population in the US identifies as LGBTQ, about 40% of homeless youth identify as LGBTQ. So they are disproportionately represented in the homeless population. And so we really felt that they needed a longer time than shelter or transitional housing to really heal and address their issues. Now, for some of our population, they do come in with diagnosed mental illness and active substance use, but it really is a place to heal. I mean, these young adults in particular really have had oftentimes really traumatic separations from their family due to not accepting their sexual identity or their gender identity. And so, and they've also, LGBTQ young adults tend to have been homeless longer than their peers. So anyway, so we call it non-time limited. It's permanent. They have a lease, they have their own studio apartment. But I mean, obviously, I don't want the average age of my young adult program to be 40. So it is an expectation that they are going to be moving on. And we help them too. I mean, this is often their first apartment also. They've never lived by themselves. So we're trying to create a community of support around them. We do life skills, budgeting, help them with, build their credit, talk about credit. What do they want to do? Go back to school, start school. Many of them are working part-time. So we have conversations about, is this, sometimes it's just a job. But sometimes it could be, if you're in a different job, it could be a path to an actual career. So we work with them about that. And generally, it's really kind of a community of healing because most of them come with pretty rough lives.
And when we talk about rough lives, I know that behavioral health is among the things that people are dealing with and contending with. And we see a rise in mental illness, we see a rise in substance abuse, and yet and still, the services aren't always there as much as we'd like to see them. I know that you're doing a great job in terms of impacting people in the area of behavioral health. Talk about the wraparound that you provide through behavioral health.
Right. So every site has a clinician who does an assessment. I mean, obviously, so first of all, services are voluntary. So even though we know that people come in with those issues, so we have to be the most engaging social workers that I've ever worked with, right? Because it is voluntary. And so part of it is developing a relationship. So we also use a harm reduction model, which means that you can come in actively using, you can continue to use while you're there. It's our job to help you see the harm that your use or non-compliance with your mental health is, how it's interfering with your goals that you've set for yourself. So if you tell me, I want to be a nurse, and I'm saying, okay, but you're getting high every day, it is unlikely that you will be successful in that program, right? If you're not paying your rent, or if you don't have food, I take that as an opportunity to reflect to you that your substance use is getting in the way of things that you have identified as your own goals, not my goals, your goals for yourself. And then I think it's the same thing with kind of compliance with mental health. I mean, some people are just anxious or depressed, and I don't say just, very serious. We do have people who have more intensive mental health issues, but if they are on the medication, stick to the regime, they can accomplish what they want to accomplish. And so our goal is to show them where their non-compliance with certain things interfere with the things that they want to do in their future.
Well, I want to ask this because you talked about somebody who does have substance abuse may be allowed to still be in the home, right? Now, balance that out, because there's some people who are watching and saying, well, that seems kind of uncommon, because if you have somebody that's substance abusing and they're living in a house, it could be disruptive to the house. It could be disruptive to residents. How do you counter that, given the fact that you may have somebody that may be in the area of substance abuse and then somebody who may not?
Right. So what I say is, it's not your use that is going to put you at risk of losing your housing. It is your behavior, right? So it is not the fact that you are using drugs. It's the fact that when you use drugs, you may be banging on other people's doors or loud or whatever, right? So what I have to say to you, I have to separate out the fact that you're using a substance from your behavior under the influence. And yes, it is true. I mean, I would love to say that we've never had to ask somebody to leave or help them move on, or sometimes obviously move them into a substance abuse treatment program. But if every time, I don't know if you know a lot about addiction, but it's a cycle, right? And so if every time somebody uses, I throw you out, how is that helpful? right? I have to allow you an opportunity. In fact, people found that as long as you can stay in a program, your relapse is a lot likely to be shorter. If I put you out and make you homeless again, then what might have been a 3-day relapse will become a 6-month or a 7-month relapse because you're back on the street. So that's not my goal. My goal is to help you be as safe as you can. I mean, obviously, I won't say it never gets to the point that people have to be asked, but for the most part, we can work with you, and the community understands that we use a harm reduction model. It is not our goal to make people homeless again.
Yeah. Jeannette, great explanation and great work that you're doing, and we want to thank you for being with us. Jeannette K. Ruffins, who's the CEO of Homeward NYC. Thank you so much for being with us today.
Thank you very much for having me.
All righty. Well, we want to let our viewers know, listen, if you want more information, all you got to do is visit their website. The website is homeward.nyc. We encourage you, stay with us. We've got more show. Open continues coming up.
All right.
Right after
Thank you very much.
Welcome back to the show. Picking up where we left off, recent studies indicate LGBTQ youth actually comprise nearly 40% of the homeless youth population in New York City. Now, New Alternatives actually increases the self-sufficiency of LGBTQ plus homeless youth, and they also help young adults by enabling them to transition out of the shelter system to live stable adult lives. We're pleased to have with us the director of New Alternatives for homeless LGBT youth. We've got Kate Barnhart. And Kate, thank you so much for being with us.
Sure, thanks for having me.
And as we talk about LGBTQ youth, we do understand that there's a crisis out there, a lot of basic needs. And sometimes we take for granted the fact that these needs are, what they are and how they really impact a person. So from your perspective, can you make us more acquainted with the fact of what LGBTQ youth are dealing with and some of the needs that they may have?
Sure. I mean, one of the fundamental things our young people are dealing with is just trying to stay alive. There are a lot of risks that homeless young people face out there. You've got folks who are, trying to prey on them, trafficking people and pimps. You also have the risk of HIV and other illnesses. You have the risk of depression and suicide. So there's really a wide range of things that can happen to young people. And so we try to get hold of people before they get into those situations and help them develop a better way of getting through their lives.
Yeah. Well, not only do you latch onto them, but you do stay connected to them. And I know that it's an ongoing process, the case management. How is it working? Because sometimes we do understand that youth are really hard to connect with and stay in touch with. How have you been making out with case management?
Well, we find we have a pretty high success rate of being able to consistently engage young people. I think it's because we use a model where we put their needs first so that they come to us and tell us what they want to work on instead of us the other way around. A lot of times people approach young people as though I'm the adult and I'm going to tell you what you need. And that pushes young people away. And so we start with what they want to work on. And then as we work on that, we build trust and they come to see us as helpful people. And then we can start to bring up some of the stuff they don't want to work on.
Well, some of the stuff they may not want to work on are those basic life skills, right? I think that when we think about our young people, a lot of people say, listen, they're already advanced, they know, but sometimes they're not as skilled as we would want them to be. And so what are some of the skill sets that you're working with them in developing so that way they can become more productive in society?
A lot of what we work on is stuff that many people get from their families growing up, but not everyone, and especially not young people who grow up in foster care. And a significant number of homeless young people have, aged out of the foster care system into homelessness. So, a lot of what we work on is emotional self-regulation, communication, managing conflict. But we also work on some other stuff. We do resumes, and we do we have people who are working in different fields come and talk to the young people about how they got into their career. And we've had people from Snapchat and BuzzFeed and all kinds of places come and talk to the youth.
When we talk about your work, I know that you've been heavily involved in HIV and AIDS, and some of the stuff that you're doing also deals with testing and prevention. How are young people being, are these LGBT youth really receptive when it comes to hearing the message of prevention and even going as far as having tests?
Well, testing, we definitely get enough people doing. We have a real HIV epidemic among this population. About a third of the clients we see are already HIV positive. And so I think that there's an understanding there, but sometimes following through on what you already know can be a challenge. And so, we have to really keep working with the young people on prevention and on, they might want to demonstrate that they really care about somebody by not being safe with them because they're like, oh, you're not the casual person, you're the one I really care about. And so we have to, get past that and work with them on, negotiating safer sex and talking to their partners.
Yeah. All work, no play. Is there some play involved? I know that they probably have some recreation that they're attached to. So do you offer recreational activities for your young people?
Yeah, we definitely do. We have an ice skating trip coming up that we're looking forward to. And we also partner with a lot of corporate groups. So when they want to volunteer with us, we don't really have enough room for a whole group of people in the building. But what we do is we have them take the young people out bowling or rock climbing or any one of a number of things that they can do around the city.
How are you able to get your hands on these young people?
Mostly the other young people find them and bring them, so they'll be signing in for dinner and the group will part and they'll be like, oh, we brought you this person. But then they also, they find us online, that's where a lot of young people are these days. And then they also, they find us through other organizations. We get calls from teachers and guidance personnel.
Yeah, I don't care what you tell me. Word of mouth is still good, still effective, even in 2022. That you could have social media, you could have marketing, but word of mouth is still a great marketing tool. I know you have staff, but also in addition to staff, I know that you also use volunteers. So how's the volunteer population, and how many volunteers do you work with?
Well, amazingly, we actually have over 2,000 volunteers on our list, but They work in a variety of capacities. So of course, they're not all here in the building. We have a rotating crew of volunteers that work in the kitchen. And so many people first starting out will sign up for kitchen shifts. But then we also have volunteers, we have recently had a couple people who work in the field doing tax prep. So they came over to do taxes for clients. And we have people who do tutoring. We have people who run groups. We have our creative writing person, for instance, as a volunteer. So there's a lot of different ways. Or we even sometimes have just single things, like we have a young person who moves into an apartment and they need help mounting their TV, that kind of stuff, So it really depends on what an individual's skill set and what they can bring to the table.
So where do you get your volunteers from? And if somebody's out there watching right now and saying, listen, this may be something I'm interested in, what's the criteria for a person to volunteer?
There's pretty much nothing. We don't have a specific criteria. You just have to be, open-minded and willing to work with the young people. You can sign up on our volunteer page, which is on our website, www.newalternativesnyc.org. And we have everyone from high school students to seniors, so it's a real range.
Yeah. For you, as a director, obviously you see a lot of young people come across your building, your desk, interact with a lot of people. Give me a little bit about what you feel the impact you're making in addressing this underserved population.
I think I can definitely see the impact every day just by looking around my office, because several of my staff are former clients who are now, adults living in their apartments, and my assistant's waving from across the room, but yeah. So, I definitely, and, certainly others of our, young people who are now well into their lives check in every now and then and, say, hey, I just bought a house, or, whatever it is.
That's awesome. Well, you're providing healthy alternatives. And for those that don't know, I'm talking to Kate Barnhart. She's the director of New Alternatives for Homeless LGBT Youth. And we thank you for the work that you're doing in serving this underserved population and bringing them some much needed resources. Kate, it's been a pleasure having you with us.
Thank you.
All righty. We want to let you know, Kate, that we are going to tell our people that they can get more information about New Alternatives. All they got to do is go to the website, newalternativesnyc.org. And then also, yes, Facebook, and also, I should say not Instagram, but Twitter. You can go to New Alternatives and find out more information about this wonderful organization. I want to let you know that we've come to the end of our show today. I want to thank all of our guests for joining us, and most of all, you, the viewer, for tuning in. Now, if you missed any part of today's show, you can catch the Recablecast on Broadcast Channel 67. Also, if you have Verizon Files, that'll be Channel 2133, or anytime on the web at bronxnet.org. We also want to thank our viewers on Manhattan Neighborhood Network, as Open is broadcast live simultaneously on the MNN channel. Now, if you want a brand new episode of Open, we encourage you to come back and join us Friday morning. My girl, Rena Valentine, will bring you the best of arts and entertainment. Until then, I'm Daren Jaime on this Wednesday. Open saying take care, God bless, and most of all, keep this channel wide open.